morning.
Good morning.
Hi everyone. So I'm Allyson Brooks, Dr. Brooks, and I'm the Executive Medical Director for the Women's Health Institute and also the Endowed Chair, the Ginny Uberoth Executive Medical Director, Endowed Chair for Women's Health. And this morning I have three amazing women, so we're super excited to have them here to share their passion and what they've done for Hoag and women in our community over the past few years that they've been here. So on my left, I have Dr. Lisa Abaid, who is a GYN oncologist. She's the medical director of GYN Oncology, and that is dealing with women's cancers. So everything below the waist and above the thigh are the gynecologic cancers that Dr. Abaid cares for and designs programs for. And in the middle, we have Dr. Heather Macdonald. And Dr. Macdonald, I refer to her as a unicorn because she does two things. She's a board-certified OBGYN, so obstetrician gynecologist, and she's also a surgical breast oncologist. So she takes care of the surgical aspects of women who are diagnosed with breast cancer. And she's going to share part of the amazing program that she and Dr. Abaid work on together to try to prevent ovarian cancers and breast cancers. And then we have Dr. January Lopez, again, another unicorn, but she's phenomenal in that she is our medical director for the breast center radiology. So she does all things regarding breast imaging, as well as oversees pelvic imaging with the team that she has created. So I'm going to go ahead and start with you, January.
Okay.
And I'd love if you could tell the group about some innovative work that you're doing regarding caring for women as far as breast imaging goes.
When I think about Hoag's breast program and innovation, the thing that I think has made the longest lasting and continues to make the most impact on the women in our community is our approach to breast care, which is comprehensive and integrative. And that really, in many respects, goes against the grain of the traditional healthcare model, which by design is very fragmented. Mm-hmm. But for us at our breast program, we think about the patient as a whole, yes. Not just an encounter. And really our focus and our goal is making sure that we're able to provide all the different components of the patient's breast care, regardless of how many encounters or what the encounters involve.
You use the word comprehensive and integrated, and for the full continuum and over a lifespan, sort of your journey of breast health. Mm-hmm. But can you describe at that first appointment or that first encounter for a mammogram, a woman is given an iPad and she completes a questionnaire. And then what happens with that questionnaire?
So the questionnaire is actually a really good example, I think, of how we try and integrate the care of patients. So several years ago, with the launch of our HERA program, which is our high-risk breast screening program, we decided that we can't see another patient who comes in, reports all these risk factors, their mom, their sister, their grandmother had breast cancer, and then not do anything about it, right. And then see them 2 years later when they come in with an advanced breast cancer because they haven't had the proper care. Right. So, with our current HERA program, women who are, within the certain age group and meet the certain criteria, we take all of them. All of them are included in this program, and we analyze their risk assessment and then notify them. Even if they're average risk, we notify them, because that's important too, right? Knowing if you're average risk, what to do. If you're intermediate risk, and especially if you're high risk, or might even be at risk for a genetic mutation that would significantly impact, your future care. Those are things that if we have the opportunity to identify, we want to do that. That's our obligation to do when we're caring for women and their breast health.
Right. So that's part of getting to know a whole woman, is understanding her family history, her personal history, and what she brings to the table so that you can guide her and navigate her in her journey. So I'm going to turn to Dr. Macdonald, and before I do, just mention that the HERA program that you brought up is, I love this story and I just have to share it, is HERA is actually, was the wife of Zeus in Greek mythology, and she was the protector of women. So we named this high-risk program HERA. It stands for the Hoag Early Risk Assessment. And so this HERA program has now been in existence for 7 years and is one of the passions of Dr. Macdonald. So could you describe a little bit about what's done with these results and these risk factors or risk assessment that January's team does?
Absolutely. So what we're talking about is a personalized breast cancer risk assessment. So it includes, as Dr. Lopez just described, family history. It includes reproductive factors like how old you were when your period started, when you had your first baby, if you were able to breastfeed or not. It puts all that personal information about a woman together and calculates what is her likely lifetime risk of breast cancer. And if she falls above a certain benchmark, above a 20% lifetime risk, we consider that elevated risk, and she's a candidate for additional screening above and beyond her mammogram, as well as some counseling about what can she do to proactively lower that risk. So how can she take control of that risk, which can be kind of scary, and actually reduce her risk. So once a woman is identified as high risk, she is offered enrollment in the HERA program, where she gets a phone call from our spectacular nurse practitioner breast expert, Michelle Booth. So if you are enrolled in the program, you get a consultation with Michelle. She calculates your risk. She goes over that calculation. She recommends high-risk screening if you are at high risk. That often includes a breast MRI. She then also personalizes a plan. What are your lifestyle factors that are increasing your cancer risk, and how can you tackle them to kind of turn that ship around?
Just to segue into kind of the next step, so Dr. Abaid, for example, you may have learned that a patient was sent to the genetic counselor and underwent genetic testing and was identified to have one of the myriad of genetic mutations that dramatically increases a woman's lifetime risk of ovarian cancer or breast cancer. What happens then? What is the HBOC program that you get up every day thinking about how can we change the trajectory of a woman's life?
The HBOC program, which stands for Hereditary Breast and Ovarian Cancer, and it encompasses a number of different genetic mutations, although BRCA or BRCA1 and 2 are the most common ones. The program is designed to detect or to identify those carriers and then have a cohesive means to follow them, both for their breast risk and for their gynecologic risks. It's very unusual to find a program that puts both of those together, even though it's kind of a natural fit. But the idea is that many of these are young women, many of these are women who have not themselves necessarily had a cancer diagnosis, but we know they're at risk for breast cancer, we know they're at risk for gynecologic cancers. How do we monitor them? How do we respect their reproductive wishes? How do we individualize that care?
Right.
I just want to point out that that's another example of how Hoag integrates the encounters, right?
Yes.
Because typically breast is an encounter, ovarian, care is an encounter, and without a specific intentional program and a focus at integrating care, you're never going to come up with something like the HBOC program, where you have all these different providers that are specialized in completely, kind of different areas, and not even just physician providers, right? But the HBOC program has a whole host of other providers, wellness providers and experts that are all expert in other things that we're not experts in, and bringing them together. It doesn't happen by magic. It has to happen with intention and requires so many resources, as you guys know.
Right. But imagine a program where the radiologist is speaking with the surgical breast oncologist who's speaking with the GYN oncologist about the totality of a patient or a woman's care and trying to be proactive in preventing an illness or a disease or a life-threatening cancer, and meeting them where they are in their lifespan.
So can I give you an example? We have a carrier come into our program who, as Dr. Abaid mentioned, may not have completed her family yet. We need to meet women where they are, and we're OBGYNs at heart. The last thing we want to do is take away a woman's capability to have children if that's something that she's not finished with. So many women with that kind of risk, we're talking 60-70% lifetime risk of breast or ovarian cancer or both, come in thinking that we're going to walk in and tell them they have to have surgery. But they see Dr. Abaid and I on the same day. We're talking to each other and talking to her, and our first question is, have you completed your family? Let's talk about how you want to do that, and let's make a plan that allows you to have your family and also tackle this cancer risk, hopefully before it happens to you. On that same day, she's had her mammogram, she's had her breast MRI, she's had her pelvic ultrasound with Dr. Lopez and her team. We've already seen the results by the time we walk into the room. So she spends a morning with us, but by the time she leaves, she has a comprehensive program for both her breast health, her ovarian health. It includes her familial wishes, which are, of course, the nearest and dearest thing to her heart. Her imaging is done. She's not waiting at home for a phone call or a letter. In addition to that, she's met our social worker.
I was going to say, and oh, by the way, we've addressed her brain and her emotional, psychological stress.
Absolutely.
Yes.
So we have a wonderful social worker who meets her to understand her understanding and her level of anxiety about this syndrome that she has perhaps recently discovered or perhaps she's known for a long time. In addition to that, because we mentioned these lifestyle factors that in some large studies contribute as much as 30% of your risk of cancer is due to choices that we make every day. And we probably know what those choices should be, but it's very difficult to change habits. So in addition to this, we have an activity coach to talk about physical activity. We have a dietitian to talk about nutrition and weight. We have a meditation and mindfulness coach who's magic, and that's to talk about stress management, because the worst thing you want to do is every time you get stressed, think, well, now I'm stressed and the risk of my cancer is going up, and now I'm even more stressed. And then we also have a sexual health psychologist, because each one of these things that we're talking about impacts her sexual health. And the last thing we want to do is prevent a cancer in her future, but somehow damage or take away from her the most important relationship she may have, which is with her significant other.
Absolutely.
So we have this team all around this
wrapped
patient.
around. It's a safety net.
Yes.
And then Hoag and all of you manage her condition to meet her where she is and do this reassessment once a year. Well, great. Thank you very much, all of you, for being here and sharing your passion and sharing your programs and for what you do every day to make the world a better place for women in Orange County.
Thank you so much.
Thank you for having us.